Welcome to Healthcare Experience Matters. This podcast is brought to you by the Healthcare Experience Foundation and is dedicated to transforming the healthcare experience so that every person can receive and deliver the best care. We invite you to learn more by visiting healthcareexperience.org. Hello, everybody. Welcome back. Healthcare Experience Matters. Today's guest, I'm talking with Jeff Robbins, a coaching leader with the Healthcare Experience Foundation. This is his first time joining us on Healthcare Experience Matters. So welcome, Jeff, to the conversation.
Thank you, Casey. It's a pleasure to be here.
So give us a little background information on your career before we jump into our discussion.
All right, very good. Well, I started back in the mid-2000s in skilled therapy and as a manager and owned a practice. And so was doing that for a couple of years and then transitioned into long-term care and subacute rehab, doing therapy contracts. And then I had an itch to go to Columbia, Missouri, and went to the university and got involved with operations management on an ambulatory clinical level and managed all the medicine clinics and did that for a few years and then got a great opportunity to work on some experience projects with a medical director in cardiovascular medicine. And that kind of springboarded me into what I love to do is engagement, experience. Did a huge project for the system and really was a successful project with data. And then I kind of dipped back into operations with psychiatry, behavioral health, did that for 2 years, and then jumped back into cardiovascular. And so now I had the opportunity, I've worked with Healthcare Experience Foundation for 3 years on a smaller scale. And now I'm full-time engaging with coaching and content and going all in with the foundation.
Our topic today, it's going to be about using data to tell a story when it comes to improving the patient experience. So Jeff, I'll let you take it from here. What did you want to tell us about today?
I guess it's important to talk about kind of the origin story of why I got into this. My medical director in cardiovascular medicine was passionate about patient experience. And she was also a mentor for the fellows, the fellowship program at Mizzou. And so she was frustrated with her scores, patient experience scores, because she knew something was not right. She wasn't trying to bust on the data. I mean, we were trying to figure out like what's the reason why her scores are struggling, because she is solid and she's all about it. So it was a manual process back then. We didn't really have all the analytics or data to really pull out things. So I just printed out all her survey responses, went through it by hand, and was writing things out on a spreadsheet. And what it came down to, on Wednesdays, she would have her fellow clinic. And then on the rest of the days of the week, she was by herself. So I looked at each day, looked at the responses, looked at the top box scores. She killed it on every day but Wednesday. And Wednesday was the fellowship day. That was a huge insight because as a provider, when I worked with them, they get so overwhelmed with a bad score. And like, where do I begin? They think, oh my gosh, my entire practice is struggling. Is it the parking? Is it this? Is it the PSR or the nurse? So what we discovered in this project, it was Wednesday only. And it was really because of the fellows interacting not inappropriately. They didn't have a smooth script. They didn't have a process for the fellows to engage with the patient. Then the physician would come in and engage, and it just was really clunky. So one day of the week, we figured it out. So we came up with a new script, came up with some talking points, some training for the fellows, and even for the provider. How does the provider explain what a fellow does? Did that. Her scores skyrocketed on Wednesday, and it was like an overnight success. So kind of the nugget here is that it's usually something very specific. It's something that can be an action plan put on pretty easily, and you can see results very quickly. So that was the origin of this passion I have.
Very cool. So that sounds like a pretty resource-intensive process when you have to go through everything, by hand to come to that conclusion. Do you still have to do it manually? I mean, this is as you had mentioned, this was a while back.
Yeah.
Is there a more efficient way now to kind of discover those patterns, or how has the way you might approach that situation changed over the years?
Great question. It has changed as health systems or clinics, or as they evolve and get more software, get the EMR and the revenue cycle, which is like all the operational data, which is diagnosis code, all their demographics, their procedure codes, all those things. What you have to do is mix the operational data with the experience data. So the experience data is the survey, right? Would they recommend the physician? Do they listen? Do they? Does the nurse listen? So all that experience data, you have to melt it with the operational data. Then you get this experience management type of platform. So at Mizzou, we had the back of the house revenue cycle warehouse. It was able to communicate with the experience data, and it was clicking on a filter and picking a provider, looking at a day of the week, looking at a diagnosis code, and then you can really pinpoint, like, here it is, it's migraines, here it is, it's hypertension, it's Tuesday afternoon. One of my most favorite examples was a physician. We looked at his days of the week. It was Tuesday mornings, he struggled. And that's my day. I take my kids to school and I'm always late to work. And I go, boom, the patients pick up on your anxiety and your stress because you're late and you're trying to hurry and get caught up and you're not connecting with them. So that was one of my favorite examples. And there's just tons of them. And it's just like, when it's one simple thing like that, it eases their mind. They're like, oh my gosh, I don't have to recreate the wheel here. This is a simple fix. Let's either adjust my schedule on Tuesdays, or I'll have my spouse take the kids to school on Tuesday. So yes, to answer your question, there has been evolution in how that's done. You can still get some great insight with, now the big thing in every system I work in is the comments or the verbatims when patients leave the why they gave you the score or how can we improve. That is the golden nugget on how you get better. So there's ways to look at that and analyze that in a short time and get some great insight as well.
Very cool. What else have you learned over the years when it comes to using data to tell a story like this?
Well, I love that question because I did a talk at a conference, and when I first started this project, we can get overwhelmed with data, and I created a lot of exhaust. I created all these dashboards, all this information that was like overwhelming. So for really a good story to be told, it's got to be concise. It's got to be intuitive. You got to be simple. And what's still happening is there's so much data. We're just overwhelmed with it. It becomes too much. So that was kind of the next step in my process, was like, how am I going to make this understandable in 5 minutes to my provider? Because if I'm coaching them or working with them, they don't have an hour. I got maybe 15 minutes. So the next step in my evolution as an experienced professional was, how can I give them nuggets of data? Like, let's look at diabetes, for example. I did a project with the patients in a diabetic education class. And so what I wanted to create was a persona of a type 2 diabetic patient. So where do they live? What type of education do they have? Personality traits, attachment styles, diagnosis codes, their family life. I created this persona.
Are there any results from your work that you wanted to share with us?
Oh, sure. Yeah, this is important. We can always kind of talk about action plans and ideas, but, you have to have some measurement to show success. And we did, I worked with probably over 50 providers from 8 service lines, 80% improved on their patient experience scores. There was a 9% increase in rating of provider, and that equaled about 15% on rankings as a group. So yeah, there was success. And of course, the physicians that were super engaged in it were super successful. This is all about developing connected relationships when you're talking about data and patient experience. And, for physicians, they're having to create this individualized experience, and they're enhancing that customization on what that patient needs. And we're leveraging all this metadata to enhance that offering for them. And me as a coach, I become a trusted partner when I bring them valuable data like this.
Jeff, do you have any other thoughts that you'd like to leave us with before we wrap up today's show?
Storytelling with data, that's what I love to do. And I try to end with an insight. I want the provider or the professional to come up with the insight themselves. That's when it works, and that's when the change happens. Tell a compelling story. I like to explain with visuals and narrate with words. Be honest and credible, clear and concise. And I cater to my audience. I know who my audience is, and I adjust. It's a pleasure to do that with people and providers, and I enjoy doing it. I look forward to continue doing it with Healthcare Experience Foundation.
Ladies and gentlemen, you've been listening to Jeff Robbins. He's a coaching leader with the Healthcare Experience Foundation. And thank you for your time today, Jeff.
Thank you, Casey. It was awesome. I appreciate it.
Thank you for listening to today's episode of Healthcare Experience Matters. Healthcare Experience Matters is brought to you by the Healthcare Experience Foundation. To learn more, please visit healthcareexperience.org. That's healthcareexperience.org.